Lado, it's high time you understand that you are only the head of the family. You are not God. Which means sometimes you might be wrong and you have to listen to Lantana because she is right. I agree that in the past your uncle has had a fracture which was successfully repaired by traditional bone setters and he turned out well. But are you also aware of how many people lost their limbs within that time frame to compartment syndrome? You know, you would ask, what is compartment syndrome? Well, in traditional bone setting, when the bones are aligned, they are usually tied forcefully in order for them to remain in place, right? This forceful tie-in usually leads to occlusion of some blood vessels that normally supply the limb. Subsequently, this results in poor healing and even worse, the limb might end up getting rotten because of lack of blood supply. As a matter of consequence, the limb will have to be amputated. This doctor is back with his wahala again. So what do you want me to do now? Thank you for asking that question. Let's assume this is the fractured limb and this is your cardboard. Just try and put it this way, manipulate it like this, and then use a clean piece of clothing or even a bandage to just tie it in order to keep it in place. And then try as much as possible to lift the limb up to be higher than the level of the body while transferring the patient to the hospital. This is done to prevent blood from accumulating in that place, causing swelling. Then if it is an open fracture which is bleeding, first thing to be done is to find something like this. This is my handkerchief which I rolled, and then this is my spoon. What you should do is to aim higher than the level of the fracture. Wrap it this way and then introduce this here, and then twist this as much as you can. That way the bleeding is going to be minimized and no one is supposed to touch it or remove it except the doctors that are going to operate on the patient. Lantana, I hope you can see that I am fighting your battle today. Before later I will come for iftar and I will see only 3 akara and pap with no sugar.